Clive Jones to move the motion.
Thank you, Mr. Betts. I beg to move that this House has considered the potential merits of a cancer strategy for England. Sorry about that. Thank you, Mr. Betts. It is an honour to serve under your guidance this afternoon. This debate on the merits of a cancer strategy for England is significant to me for many reasons. When I was diagnosed with breast cancer in 2008, it came as a massive shock to me and to my family. Questions whirl around in a haze of uncertainty. Is it serious? What's going to happen next? What does the future look like? What treatment will I have? And some people will think, am I going to die? And sadly, far too many people do. Cancer is an evil that takes your life completely out of your own hands. The hardest thing that I had to do was to tell my two daughters of my diagnosis. They were 13 and 14. This was, of course, a very emotional time. Was our family of four about to become a family of three? Because of the delay in diagnosis, my cancer spread. I had surgery twice, chemotherapy and radiotherapy. And I was one of the lucky ones who survived. And looking back on my personal experience of the NHS, I can only be grateful and thankful for the service that I received. Our NHS consultants, oncologists, radiologists, radiographers, histopathologists, specialist nurses, they work with diligence and dedication to provide their patients with the best possible care. And yet it is hard not to reflect that being diagnosed in 2008 was in one respect a blessing, because cancer care in 2024 simply isn't working. When I read Lord Darcy's independent investigation of the NHS in England, he plainly said that our NHS is in serious trouble. It did not surprise me to read that his report called out the failings of cancer care. And I felt genuine anger when he highlighted some of our services lagging behind other countries. Because, as a stark reminder, the UK has higher cancer mortality rates than any other comparable country. 1 in 3 patients are waiting longer than 31 days for radical radiotherapy. And the national target to start treatment within 62 days of an urgent referral has never been met since 2015. These are statistics that the Conservative Party should be ashamed of. In my constituency, Wokingham, most cancer care is delivered at the Royal Berkshire Hospital. And I'm thankful that we have fantastic people working there. Now, I'm sure ministers at the Department of Health and Social Care are sick of me saying it, but the Royal Berkshire Hospital urgently needs a rebuild. The consequences of delay, disrepair, degradation put patients at the front line of risk to their health, and they see firsthand the consequences of failing to invest in the future. This is especially clear in cancer care. Some of the Royal Berkshire cancer treatment is performed in buildings that were built when the Viscount Melbourne was Prime Minister. That's 1839. A broken estate is one of many issues stopping cancer standards being met and putting patients at risk. As across the country, the target of 85% of patients starting their first definitive treatment within 62 days of referral is not being met. These statistics are shocking. These are people with families and friends, people who deserve better.
My honourable friend give way.
I will.
I thank my honourable friend for giving way and for allowing, for arranging this, for putting forward this motion for this debate in Westminster Hall. I mean, some of the statistics that he's shared are truly shocking, and I'd actually particularly draw attention to the survival rate statistics, 5-year survival rate for pancreatic cancer, which several of my constituents have raised with me. Their heartbreaking stories of losing loved ones, and from a position of diagnosis at stage 4. And it really highlights, would he agree with me that it really highlights, particularly with those statistics, the need for cancer strategy in the UK to up that early diagnosis and drive forward research.
To the point, not a substitute for another speech. Clive Jones.
Thank you, Mr. Betts. And thank you for your intervention. I absolutely agree with you that this is why we need to have a national cancer strategy, because so many cancers don't get the resources that they need. Everything is a bit too general. There's lots of cancers that really need to have very focused and targeted resources, which will lead to better outcomes.
On that point, will the
Yes, happy to
I'm
give
really
way.
grateful to the member for welcoming me in hosting today's debate. The Health Select Committee in the last Parliament did an inquiry into future cancer and came to the conclusion from all the evidence that we received that a bespoke future cancer strategy was needed to support the NHS, not combined in a major condition strategy, which frankly went nowhere under the last government. So I congratulate him in advocating for that. But will he also read the report from the Select Committee, the letter that we wrote about all of the interventions that this government could take up in driving forward cancer care?
Thank the Honourable Lady for her intervention. I am aware of that report, and I will refer to it later on in my speech. If I can continue, these challenges are only going to grow. We've probably forgotten what I was just saying, but experts state that 1 in 2 of us will get cancer in our lifetime. An expanding and ageing population means the number of cancer cases is only going to grow. Cancer Research UK projects that there will be around 2.2 million new cancer cases in the current parliamentary 5-year term, a 21% increase over the previous term. Cancer services are struggling now, and they will continue to struggle to keep up with demand. We have a greater number of people being diagnosed, but we have services that aren't working. The challenge is really stark. But there is a diagnosis for this problem, and now we need to deliver meaningful action to recover England's cancer care to full health. The Liberal Democrats have made cancer care one of our top priorities for health, and there are many policies that we think are crucial to boosting cancer survival rates. We call for the introduction of a guarantee of 100% of patients to start treatment within 62 days of urgent referral. And we can't just be content with replacing old radiotherapy equipment. We need them to be replaced but we also need more of them. We're calling for the recruiting of more cancer nurses so that every patient has a dedicated specialist supporting them throughout their treatment. These are crucial policies and all would feed into the very first step we must take, which is England needs a dedicated cancer strategy. It really beggars belief that we don't have one. A cancer strategy is the best route to deliver genuine improvements and outcomes for patients, their families and their loved ones, and those who work in our health system to research, prevent, diagnose and treat cancer. Now, the recent announcement of a 10-year health plan for England and its aim to improve health outcomes for all is very welcome. However, I fear that the plan for all could be a plan for none. For example, analysis from Bowel Cancer UK found that existing NHS long-term plan failed to sufficiently address the barriers to early diagnosis for bowel cancer. And this is the case across many cancers. The approach is just too broad. We need detail. We need the political will to be focused. We need to see a rapid and urgent turnaround. And a dedicated cancer strategy would provide a huge opportunity to fix the entire system, not just for the present, but for the future, for our children and for our grandchildren. It would not be simple nor easy, and that is why a strategy requires political will and bold leadership to bring together Whitehall into making tackling cancer a priority. It is clear when there is strong, bold leadership that cancer strategies work. This is the case across the world. At present, England is an outlier in not having a cancer strategy, internationally and across our 4 nations in the UK. Comparable countries with a cancer strategy have received greater improvements in survival rates. For example, having started from a similar position in the 1990s, countries such as Denmark have raced ahead of England in improving survival in recent decades. Denmark's success is linked to a series of cancer strategies that successfully and strategically built upon each other over a 20-year period to tackle some of the critical issues facing cancer services in that country. In the past, cancer strategies have worked in England. The 2000 Cancer Plan for England set ambitious targets across research, prevention and care outcomes. And the National Audit Office report found that this strategy had supported progress in most aspects of patient experience. Now, the previous Conservative government launched a consultation on a 10-year cancer plan for England in February of 2022. And they promised to wage a war on cancer. And yet the Right Honourable and yet the Health Secretary, the Right Honourable Member for North East Cambridgeshire, scrapped the dedicated cancer strategy, turning it into a broader major conditions strategy. But delays and more delays meant the strategy was never published. Just another legacy of failure from the Conservatives. The Health and Social Care Select Committee wrote to the government in May of 2024 and argued that it was a mistake for the Conservatives to abandon the 10-year cancer plan. So this government has the opportunity to turn this around. A cancer strategy is very popular with the public. Almost 8 in 10 people think the government need to develop a long-term and fully funded plan for cancer. Organisations from the Cancer Research UK and Breast Cancer Now to global biopharmaceutical companies and medical institutions support a cancer strategy for England. Yet this effort requires cross-government thinking and focus. It requires the ambition to make England and the UK a world leader in cancer outcomes and in research. But that effort means we have the chance of tens of thousands of lives being saved, of millions of people who will not need to suffer the upset of losing someone who is a loved one or is a friend. Last week I tabled a private member's bill calling for the government to implement a cancer strategy for England. But unlike other private members' bill, my legislation doesn't need to be law for it to happen. The government could make the decision tomorrow to kickstart the work to implement it. And if my interpretation of Hansard is correct, they may well be intending to do so. The Secretary of State for Health, in response to a question from my honourable friend, the member for North Shropshire, recently said, the government will work tirelessly through a national cancer plan to make sure that we deliver the cancer waiting time standards that the last Labour government met. A national cancer plan sounds quite similar to the National Cancer Strategy. And so I'd like to use this final section of my speech to make some recommendations to the Secretary of State as to what his cancer plan could be and probably should include, because the Department of Health and Social Care are seriously considering doing this, they will need to get it right. Broadly, it needs to cover all aspects of cancer prevention, research and care. It requires political leadership to bring together stakeholders to develop a strategy and coordinate implementation. It requires dedicated governance. There must be a robust central oversight function with a mandate to bridge the gap of disconnected government structures. It must clearly detail how it is going to implement the strategy with measurable objectives and achievable timelines. It must have a regular, robust and transparent reporting of implementation. And inevitably, it needs dedicated resources to enable the right change. A cancer strategy also provides the opportunity for us to unlock innovation in the future. We are living in a golden age of cancer science. New types of cancer treatment, for immunotherapies to cell gene therapies, are enabling clinicians to attack cancer from multiple angles. These advances are helping to improve cancer outcomes. Therefore, I would implore the government, if they do take up a cancer strategy, to look how NICE can be reformed to unblock barriers to investment and to strengthen the current infrastructure to increase genomics and biomarker testing. I could go on, and we could discuss the historic lack of strategic direction in having a national policy for blood cancer, or that every day 12 children and young people hear the news that they have cancer, and sadly 10 die every week, making it the biggest killer of disease of children and young people in the UK. And despite this, it remains overlooked in existing strategies and reviews. I think this reflects the scale of the challenge that we are facing in English cancer services. It feels like a never-ending list of things that we need to fix. So I would like to use this opportunity to ask the Minister just a few questions. Can the Minister reassure people living with cancer and cancer charities that the government will address the current crisis facing cancer services? And will they build on long-term resilience through a dedicated cancer strategy? Can he give his support for my private member's bill, which would put into legislation the requirement for the government to establish a 10-year cancer strategy? And can he meet with me, and more importantly, representatives of the cancer community, to discuss the need for a cancer charity? And finally, can the Minister make the case to his colleagues, the Minister of State for Health and Social Care, the Honourable Member, and the Honourable Member for Bristol South, that the Royal Berkshire Hospital requires an urgent rebuild? Yes, I will.
I'm really grateful. The Honourable Member is making an incredible speech, very powerfully here today. Will he also add one more ask on his list, and that's for the cancer strategy to be joined up with a life sciences strategy, because the UK is fantastic at its primary research around cancer. However, there's work to be done in scaling and translation of that research into being able to deliver a holistic product for the whole of cancer care and its treatment and therapies which ensue from that.
I'd like to thank the Honourable Member for a very, very good intervention. We are really lucky in this country to have many life science businesses and many who would really like to be working in a joined-up cancer strategy. I have several in my constituency in Wokingham that I know would really, really like to be doing that. So that's a very, very good point, and thank you for making it. So, in conclusion, let's utilise this crucial opportunity to fix our cancer services. Because in the Wokingham area, 360 people will die of cancer in the next year. There will be around 2,000 cancer deaths in Wokingham over the next 5 years of this current Parliament. And we need to do our best to make sure that that figure of 2,000 is not reached and it comes down. Thank you.
The question is, this House has considered the potential merits of a cancer strategy for England. I'm trying to count which members would like to speak in the debate. 1, 2, 3, 4, 5, 6, 7. Okay, thank you for that. There's 7 members, I count that. So that gives us about 6 minutes maximum for contributions, right? Without imposing a rigid time limit, that's an indication of how long you should be trying to speak. First of all then, Tony Vaughan.
Ms Betts, it's always a pleasure to serve under your chairship, and I thank the Honourable Member for Wokingham for securing this important debate. I want to start by talking about a constituent who emailed me last week, who is a cancer patient. She was discharged from hospital and she was informed that there is no specialist cancer rehabilitation and recovery support in Folkestone. And that is a town that has a population of some 52,000 people. She was told that the nearest support could only be accessed in Dover, which is the neighbouring constituency, or New Romney, which is some 14 miles away. But she does not have a car, and the effects of the cancer treatment make it very challenging to move around. Folkestone has a single cancer support nurse allocated to it, but the cancer nurse is expected to cover the patients of 8 GP surgeries in the area in Folkestone, as well as Dover, a town that has a population itself of 116,000. And you obviously don't have to be a maths genius to work out that that ratio of nurses to population is unacceptable. We know that cancer is the UK's biggest killer. Today, more than 3 million people are living with cancer as we speak. And as Lord Darcy's recent report highlighted in stark terms, that cancer patients are waiting far too long to be diagnosed and are waiting far too long to be treated. When they leave hospital, there is also inadequate support for recovery and rehabilitation. The lack of a national cancer plan correlates and is likely to be one of the causes of these geographical inequalities in access to cancer care and rehabilitation, as I believe there are in my constituency of Folkestone and Hythe. I appreciate that we have had the NHS long-term plan, which includes important commitments for cancer services, but does not provide the comprehensive transformation needed across all areas of control, including research and prevention. A critical question for the government is what we can do to ensure that a national cancer strategy generates additional capacity in cancer care and rehabilitative support. The statistics are shocking and are a national disgrace. According to Macmillan Cancer Support, in 2023, almost 90,000 people with cancer across the UK waited more than 2 months to start treatment from the point of either urgent referral or when the cancer was first suspected. The most recent cancer care waiting times for England to July 2024 show that only 68% of people received a cancer diagnosis referral. The target of 85% has not been met since 2015, as the Honourable Member for Wokingham earlier reminded us. The situation is not inevitable. I agree that we need to start with a comprehensive plan for cancer, which many of our European partners have. When the 10-year NHS plan is published in spring next year, it should contain a national plan for cancer that focuses especially on how waiting times for diagnosis and treatment can be reduced, and also how geographical variations in the quality of cancer treatment and care can be tackled. The plan should focus on how, as a nation, we can recruit and retain cancer care and rehabilitation specialists, how we can utilise new technologies and medicines to improve treatment outcomes and increase survival rates, and how we can utilise our thriving life sciences sector, to which my honourable friend, who's not in her place now, made reference, to reduce diagnosis and treatment waiting times. I fully appreciate the state of the NHS that this Labour government has inherited, an NHS that struggles to recruit and retain, an NHS that has been starved of capital investment, an NHS whose workforce have had their morale beaten down by successive Conservative governments. But we can do better. It falls to this Labour government to lead the way forward so we have an NHS that can effectively treat, rehabilitate, support and prevent this terrible disease. And I want to end by paying tribute to charities such as Macmillan that do a brilliant job of providing cancer care to patients, and we must never forget their compassion, empathy and service, which should inspire us every day in this House. Thank you.
Sir Roger Gale.
Thank you, Mr. Clive. I don't want to go down the road of party politics with this. The last government poured shed loads of money into the National Health Service, and throwing money at the problem is not the answer. I'm not saying that there isn't any demand for more capital expenditure, there is. But that isn't the point. We've got to get the structure right. And then unless we get the structure right, we're just going to go on wasting more and more money. And I think we need to be grown up about this, Sir Clive, and all understand that. In the very few minutes that I've got, I want to concentrate on one issue that was touched on briefly by the Honourable Gentleman, the Member for Wokingham, but only briefly. And that is the incidence of cancer in young people. It is many years now since my eldest son used his wedding, and probably his bride as well, to raise money for the Teenage Cancer Trust. And in the time between then and now, sadly, not a very great deal has changed. That is lamentable. I think the point was made that every day, 7 young people between teenage and mid-20s are diagnosed with cancer, and by the end of this decade, that figure is likely to have risen to 10 per day. Now, most of us in the room probably have members of family or even personal experience, as the Honourable Gentleman clearly has, of cancer. We all know somebody who's had cancer, and sadly some of us know only too well people who've died of cancer. But the incidence of cancer amongst young people is very widely disregarded and neglected within the health service and beyond. It's not infrequent for a young person subsequently diagnosed to have to make at least 3 visits to a general practitioner before even being referred, because it is assumed, Sir Clive, completely wrongly, that cancer is something that affects old people, people like me. I'm expected to get cancer. But young people don't get it, do they? Well, sadly, yes, they do. 7 a day, rising to 10 a day by the end of the decade. So, my plea to the Minister is to take away this message. However much money is being pumped into the health service, however much money is being made available for investment in diagnostic kit, there is a real need to address one area of the population that has been neglected, and that is teenage cancer victims. It is the largest single killer of young people in this country, bar none. And yet young people are overlooked when it comes, for example, to clinical trials that could be life-saving. There's a very real reason why young people, as a proportion of the population, should be included in clinical trials, but they're not. They're overlooked. Why? Because, again, there is the assumption that this isn't a disease that affects young people. Well, it does. So I want to make this plea on behalf of those of my family who support the Teenage Cancer Trust, and those who have taken the trouble within the Teenage Cancer Trust to brief members of Parliament, to ram home this message to the Minister and ask him to take it away to the Secretary of State and focus very clearly, when we set up, as I'm sure we will, a national cancer strategy, to make absolutely certain that this age group, the 13 to 25 age group, is given the recognition that it deserves, so that they get the diagnosis in time before they die, and so that they get the treatment that they need, and so that they're included in clinical trials. Thank you.
Your law.
Thank you. I won't be making a speech in this debate.
I think Jim Shannon probably will be making a speech, yes.
Thank you, Mr. Chairman. I think there would hardly be a day I wouldn't be making a speech, but anyway, that's by the way. First of all, can I thank the Honourable Gentleman for Wokingham for bringing this forward, and also for his personal story. It's if you ever want to illustrate an issue, do it with it if you can with a personal story, and I have to say thank you for that. That was incredible. I'm minded of the Honourable Gentleman's story, and I think of my dad as well. My dad had my dad's dead and gone now, but when he was living in this world, he had cancer on 3 occasions. This went over many, many years ago, whenever the expertise that we have today for cancer and their care and their healing wouldn't just been as good then. But anyway, he survived because of the surgeon's skill, of the nurse's care, and also because he was a Christian and he believed in very, very clearly in God's help and the prayers of God's people. Can I just first of all start this debate by saying how pleased we are to see the £22 billion been set aside for the NHS. I think that's constructive, it's positive, and we should welcome that for the purposes that it's set aside for. Within that £22 billion there'll be money for radiotherapy, hopefully there'll be money there for training and bringing the staff forward, and that's really important to have that as well. Honourable Gentleman referred to the Royal Berkshire Hospital, and of course for us in relation to where we are in Northern Ireland, we have similar problems. I want to just also tell a story. It's a story that's been often heard. I'm sure most of us in this House were struck by the candid and very emotional video released by the Princess of Wales to inform the nation that she was going through in the Valley of Cancer. I don't think I can ever forget that. This video was in response to a concerted campaign of disinformation against the Princess, and my heart indeed probably all our hearts, ache at the way that the Princess of Wales was so disgracefully confronted with that every day. She was forced into a declaration of her intensely private journey with cancer, highlighting the effect on her husband, children and family. This very public declaration and the updates that she had so wonderfully provided have started a very wide conversation about the dreaded C word, and the Princess of Wales do that, and we are deeply indebted to her for making that as well. And then we had the announcement of the King's health, of course. Again, certainly surprised and immediately prayed for him, as I do every day. But the Princess of Wales announcement, a young woman in her prime, goes back to what the Right Honourable Member said in his contribution before, that many people see cancer not as a disease for younger people, but the Princess of Wales, when she was apparently so healthy, so vibrant, has certainly caused many of our young people to remember that cancer is not a disease which is irrespective of person, age, religion or background. All are brought to their knees by this disease which is ravaging the nation. In Northern Ireland, the target is that at least 98% of patients diagnosed with cancer should begin their first definitive treatment within 31 days of a decision to treat. At least 95% of patients should begin their first definitive treatment for cancer within 62 days. The problem is that those timescales here in the UK mainland and for us back home in Northern Ireland are not always met. Indeed, they're very rarely met. The issue means that that first definitive treatment, which is so important, doesn't happen in the time that it should. Those figures are not getting any better. I'm hopeful, Mr Chairman, that through the £22 billion that has been set aside for the NHS, that through the Barnett Consequential for Northern Ireland, we will get additional money for that, and then we can use that money for the specific task that it's used for, it's sent for, and that is for cancer treatment. Could I also make a point for research and development, and make a play, if I can, for Queen's University in Belfast, in the partnerships that they have with companies and the students they bring from all over the world to find treatments and cures for cancer and what they do. Now, I know that happens in many other parts of the United Kingdom, and it's good that it does, but research and development is so important. So maybe, Minister, in the summing up, you can give us some ideas about research and development. I'm very pleased to see the Minister in his place, and welcome him to that as well. The question that we should be asking, the question must not be should we lower the target. The question is how we deliver and meet the target, and that's the target of curing cancer. Having spoken to a number of cancer specialists, the need for greater staff in radiology and labs to provide a quicker turnaround, as well as the need to ensure there are trained specialist cancer nurses and staff in place, is a long-term issue that needs to be dealt with, not with words but with action. We need to spend the budget in a much better way, and maybe the Minister can give us some ideas of how that will happen throughout the United Kingdom. And I believe that this is in the recruitment of staff and all facets of the cancer machine, in the labs, in radiology, in pharmacy and care. Every area needs specialist training, and we need to keep those staff in place with better working conditions, rather than the wonderful staff that we have who are simply burning out due to the pressure.
No, Lord.
The father of my constituent, Eloy Martyr, has been diagnosed with bowel cancer, and despite a difficult time, his father is being looked after amazingly well by NHS staff. Will the government, if indeed it commits to a national cancer strategy, ensure that the second biggest cancer killer, bowel cancer, is given sufficient attention, and that we address the staff and kit shortages acute to that particular cancer, and that we also ensure that we improve the bowel cancer screening programme to improve the chances of survival for that particular cancer?
I thank the honourable gentleman for that intervention, and I'm of an age, as I'm not sure there's many others are in this chamber, but where you get your bowel cancer checked every year. They send you the kit out to do the job, so to speak, and we do that. And thankfully, every time that I have done those bowel cancer tests, they've all come back negative. And I got to be fair, the NHS have a good system for that. When you reach 60, you get it. and you do the tests, and they come back to you very quickly. If something wrong, you'll hear right away. So I think while we sometimes ask for money and sometimes criticise rightly so, I think we should always recognise some of the good things that the NHS does as well. So you're right to bring that up, and thank you for that. I conclude with this, Mr Chairman. The question of cancer care in England is the same question in Northern Ireland. How can we get the best outcome with what we currently have, and how can we plan to do better in the future? Neither of these are easy questions, but the fact that some, and these are drastic figures, 9,000 new cancer diagnoses are made every year in Northern Ireland, and a population of 1.85 million, equating to 1 in 2 people developing cancer within their lives, means that this must be a priority for us all. I know the Minister in his response will give us some positives in relation to where we are. I expect those, knowing the nature of the Minister that he is, but also it would be helpful, Minister, if we can have some idea how we can better do this together across this whole United Kingdom of Great Britain and Northern Ireland. Thanks so much.
Claire Young.
Thank you, Mr Betts. It's a pleasure to serve under your chairship, and I'd also like to thank my honourable friend for securing this debate. 2.2 million people are expected to be diagnosed with cancer during this Parliament, and almost 1 in 2 of us will get cancer in our lifetime, so we should all be concerned about the crisis in cancer care that was highlighted by the Darcy review. In Thornbury and Yate, my constituency, just over half of cancer cases are diagnosed early. That's around 2,500 people a year. But just over 2/3 of those diagnosed are able to start treatment within 2 months after being referred, which is far lower than the 85% NHS target. Now, this government has promised to do more to tackle the delays in cancer diagnosis and treatment, and I think that a specific cancer strategy is the way to achieve this. I'd like to illustrate this with 2 examples from my constituency. The first constituent suffers from a rare cancer condition, and they sought treatment at Cheltenham General Hospital, where they received immunotherapy treatment. However, they have since been informed that their treatment will cease on the 31st of January 2025 due to financial considerations. This simply isn't acceptable, to have a situation where a patient is told they need a particular treatment and then to have it halted partway through, not because it needs to stop for their own best interests, but because of financial constraints, is absolutely appalling. And it's a glaring example of where the system is failing. Everyone who has cancer deserves timely and consistent treatment. So the first thing I'd like to highlight for ministers is that when they're looking at producing a cancer strategy, will they look at the treatment and how it's delivered to make sure that decisions are being made in the best interest of patients rather than the accountants? My second example shows how early treatment can save lives. This constituent told me how in 2021 they were diagnosed with cancer in their eyes. They're one of the lucky ones. It was caught early by their optician and they got an urgent referral. And because they got treatment quickly, they are still cancer-free today. However, it's fair to say they're not out of the woods. There is a high chance of recurrence and possible metastatising happening in the coming years. And they told me how this is hanging over their head every day. But the point they make is that all it would have taken is one more small change, and instead of living their life, they could have no longer been with us. And this shows exactly why identifying and treating cancer as early as possible is vital. And I think it highlights in particular the importance of professionals who aren't specialists in cancer, but who play a vital role in identifying possible signs of cancer at an early stage. There are probably people up and down the country who can give examples of how pharmacists, opticians, dentists and so forth have been the ones who set them on the road to that all-important diagnosis. And as we know from other debates we've had in Parliament, all those professions are under strain. We know that people can't get dental appointments, and yet we know how important that is for identifying all cancers. And we know the pressure, I raised in Parliament this morning, the issue of the pressure on community pharmacists. So I would ask that when the strategy is drawn up, could ministers look at the importance of non-specialists in referring people for diagnosis and ensure that that forms part of the strategy. So to sum up, I mean, we've already, my honourable friend, the member for Wokingham, identified Denmark as a good example of a country that had been where this country is, but has managed to race ahead. And the point there is it was a series of cancer strategies. And there's been reference to delays, or perhaps we should make this part of a wider strategy. Let's get something done as a starting point, and then it can be an iterative process that it can be looked at again, and gradually we can make the improvements we need. So I think a dedicated cancer strategy would complement the government's 10-year health plan by offering a clear roadmap for an integrated approach to improving outcomes across cancer prevention, diagnosis, treatment, research and care. And that's why we need a dedicated cancer strategy and a wholesale review of the system to ensure everyone gets an early diagnosis and the treatment they need when they need it, and are fully supported in their journey with cancer. Thank you.
Forster.
Thank you, Mr Betts, and I'd like to thank my honourable friend Clive Jones for securing this debate on the urgent need for a comprehensive cancer strategy, and particularly for his moving personal story that I think touched us all. From my constituency's perspective, from Woking, but then my county in Surrey, the situation is increasingly concerning, similar to how my honourable friend for Wokingham stated. Woking doesn't have a dedicated cancer centre, which meaning my constituents, when their patients, have to travel outside the area to receive specialist care. This adds to the burden of those that are already facing the weight of life-changing diagnosis. So my constituency, like the rest of England, we really want this strategy that actively meets the needs of our patients and improves access to timely and high-quality cancer treatment. This year, 2024, is projected to be the worst year on record for cancer care since the NHS last met its 62-day target in 2015. Already, more than 72,000 patients across the country have not been treated within the NHS's 62-day window from referral to treatment. More than 72,000. If those trends continue, we could see over 107,000 patients treated outside the standard by this year's end. That simply isn't acceptable. To put this into perspective, the number of patients who didn't start treatment within the 62-day timeframe back in 2015 was just under 27,000. By the end of 2023, the figure had risen to over 100,000, and it's continuing to climb this year. This increase is staggering, nearly fourfold. And each of those statistics represents real people, our constituents, facing unnecessary delays at the most critical time for them and their families. The causes are clear, and so are the consequences. Each delay not only impacts the outcome for patients, but also it places a strain on the healthcare system, the wider employment system as well. What we need now is long-term, a well-resourced cancer strategy, as exactly outlined earlier, that prioritises investment in early diagnosis, improves treatment infrastructure and supports the research needed to make real progress in combating cancer. Patients in Woking, but across the whole country, deserve nothing less. A national cancer strategy would help reduce the postcode lottery for cancer care, ensure prompt treatment, and provide patients with the security of knowing that our health system is equipped to meet their needs. I urge the Government, in particular the Minister, to work with us to reverse this distressing trend and deliver the strategy that we desperately need. Thank you.
Mr. Munt.
Thank you, Mr Betts, and may I thank my colleague and friend, the Honourable Member for Wokingham, for calling this timely and critically important debate. It's also good to see the Minister for Care in his place. I'd like particularly to mark the passing of many friends and some of my family who've lost their lives in a battle with cancer. It's a dreadful, dreadful disease. When I arrived here in 2010, my team and I started a 5-year project tracking the use of radiotherapy in England, using Freedom of Information requests every 6 months to gather data on the availability and frequency of the use of stereotactic ablative radiotherapy in England's then 51 cancer centres. It was not a pretty picture. It's a pleasure to return to the subject of radiotherapy, about which many of my constituents in Wales and Mendip Hills care deeply, as do I. I recall Graham Morris, the MP for Easington, and I had common cause. He represented a constituency in the North East, and I one in the southwest of England, the two areas with the greatest incidence of cancer per head of population. I hope and trust every one of us is persuaded that when confronted with a serious problem or challenge, the odds of successfully tackling it are immeasurably improved if one has a plan. Without a plan, there is a serious risk of misguided or confused action. Benjamin Franklin, one of America's founding fathers, reportedly said, if you fail to plan, you plan to fail. That phrase is as relevant now as when he said it nearly 300 years ago. In England, we are in a battle royal against this deadly disease of cancer, a disease that will directly affect 1 in 2 of us, as has been mentioned, and indirectly affect almost every one of us through our connections to friends or family. The evidence is absolutely clear. Countries with a dedicated cancer control plan show a 5-year better overall cancer survival rate. This is not anecdotal. It is the clear result of an international cancer benchmarking partnership study published in the Lancet Oncology. A report in the Lancet Oncology by 12 leading cancer experts published a blueprint for a national cancer plan. Those experts were from Imperial College London, Catch Up with Cancer, Radiotherapy UK, the Faculty of Public Health and Policy, London School of Hygiene and Tropical Medicine, the Institute of Cancer Policy at King's College, London. Their blueprint consolidates 4 reports published separately in the Lancet Oncology over 2 years, clearly outlining the necessary steps, a plan, to improve cancer outcomes. The need for a plan is urgent. We had a 10-year one which ran out in 2022. The then Health Secretary promised a new one. There was a 5-month consultation, and then the next Secretary of State binned the whole idea. We're in a dire situation on the cancer front. Cancer mortality in this country is amongst the highest in the OECD. Our performance against the key 62-day target to start treatment has not been met in England since 2015. And when you consider the international research shows that a 4-week delay in cancer treatment can increase the risk of death by 10%, this failure to meet that 62-day target has potentially fatal consequences. If the government is in any doubt about the consensus across the cancer care community on the need to get back to having a dedicated cancer plan, it needs only to make a cursory scan of all the charities and other stakeholders. Almost without exception, every organisation of any standing is in favour of getting a cancer plan and getting it fast. As is widely known, there are several main cancer cure pathways: surgery, chemotherapy and radiotherapy. Any cancer plan would obviously need to include all of these pathways. But if I may, Chair, I'd like to say a few words about the last of those, radiotherapy, in the context of any such cancer plan. For clarity, I'm talking about radiotherapy, not radiography. Radiography is vital. It's the use of techniques to scan and image to detect potential issues such as cancer. Radiotherapy is the use of high-energy radiation to kill cancer cells. If any of you is perplexed at my need for this clarification, you may understand more when I say that some former Secretaries of State for Health and Social Care have been heard to confuse the two. I'm confident that this Minister and the current Secretary of State will not suffer a similar confusion. Radiotherapy offers technologically advanced, cost-effective, personalised and precise solutions to treat more patients, more quickly, more accurately and better. We have about 270 radiotherapy machines in England. Of those, 70 of those machines will pass their 10-year recommended life this year, and replacing these would cost 150 million. The Minister will know this would be money well spent, as it takes people off the waiting lists and straight into treatment, gives them a life chance that's longer, and many will return to work, just like my honourable friend, the member for Wokingham. Until recently, radiotherapy has been overlooked in terms of priority and investment. So I'd like to pay testament to the impressive work of Professor Pat Price, Radiotherapy UK, the charity she founded and still leads. I'd also like to thank the Secretary of State for Health and Social Care for agreeing to meet with Professor Price, representatives from Radiotherapy UK and me, so we can all do what we can to help. I'm sure the Minister for Care will be involved in that conversation. Professor Price's relentless campaigning is putting radiotherapy back at the heart of the political debate. This was reflected in the recent budget announcement of 70 million for new radiotherapy machines. It's not enough, but it's a really positive start. The recent Radiotherapy UK productivity report shows that smart investment in this sector could create 87,000 new cancer appointments. And the need for any national cancer plan to have measures to boost radiotherapy within it is clear. Only 27% of cancer patients in the UK access radiotherapy that they need, compared to the international recommendation of 52 to 53%. 7.4 million people in the UK live in radiotherapy cancer treatment deserts. Lord Darcy's independent review of the NHS revealed that more than 30% of patients are waiting too long for their radiotherapy cancer treatment. Radiotherapy can't be used on cancers, not all of them. Sorry, it can't be used on all cancers. But when it is appropriate, a typical radiotherapy cancer cure can cost as little as £3,000 to £5,000, dramatically less than chemotherapy. The case for a national cancer plan is well made. May I urge the Minister to bring the experts in and produce such a national plan. Thank you.
Thank all honourable members very much for adhering to the time guidance. That's really helpful. Moving on to the front benches now, 10 minutes each. And, oh, sorry.
It's Max Wilkinson. Max Wilkinson.
Well, Max Wilkinson, yes. Just take 3 minutes, please. Okay.
Thank you, Mr Betts. It's an honour to serve under your chairmanship. I will be as brief as I possibly can. And thank you to the honourable member for Wokingham for securing this important debate. 2 days ago would have been my father's 64th birthday. Sadly, he died of lymphoma in 2018, aged just 57. And recently we passed in my family the date of 18 months since my wife was given the all clear following ovarian cancer. It is thanks to the skill of a highly qualified surgeon who removed an absolutely huge lump from her that she is with us today, and I'm very grateful to them every single day. Much has been said about the need for the strategy. I will offer the Minister one local opportunity, and it is an opportunity because the previous government, despite taking some political credit for it in Cheltenham, has failed so far to offer very much money to the Big Space Cancer Appeal for revamping Cheltenham General Hospital's Oncology Centre. As a regional cancer centre, Gloucestershire Hospitals Trust treats thousands of patients each year, but many of those buildings are now at end of life. Many of the rooms have no natural light, and the outdated design is unsuited for the number of patients in need of treatment. We know that identifying cancer early and beginning treatment soon after it is key to giving people the best chance of survival. Gloucestershire Hospitals NHS Trust staff work very hard, but they are working under huge pressure, and it is no secret, as others have mentioned, that targets are routinely missed. Our local trust is not alone in that. Many staff in the Trust feel that the current space is not fit for purpose, and that certainly will not help their best efforts. That's why the Trust has launched the Big Space Cancer Appeal. But it is representative of the challenge that we face in not having a strategy for dealing with cancer. That the last government gave almost no money to this, and the £17.5 million that's being raised is almost the entire capital cost of the project. The new centre will offer patients a modern space and a better environment for treatment, for healing and for recovery. It will provide modern consulting rooms, allowing more patients to be treated every day and helping to cut down waiting times so that not only can targets be hit, but patients will get better outcomes. And for some, this will mean the difference between life and death. You've asked me to be brief, Mr Betts, so I will draw my remarks to a close. I will end by saying thank you to Drs Sam Gugliani, Drs Charles Candish, and all the staff at the Hospitals Trust Charity, because this is a charity-led initiative, but also backed by the Hospitals Trust, which does not have the funding to deliver it itself, and to Dr Diane Savoury, who's been working extremely hard on this project. I would urge the government, if it's looking for opportunities to invest in cancer care, and we've already heard some of the consequences of not doing so in my area from my honourable friend, the member for Thornbury and Yate, I would urge the government to get in touch, because there is a real opportunity here to make a huge difference on the ground. Thank you.
Moving on now to the front benches, and if we could just leave a minute at the end for the mover to respond, that would be really helpful. First of all, the Lib Dem spokesperson, Paul Kohler.
Thank you, Mr Betts. It's a pleasure to serve under your chairmanship, and I would like to thank the member for Wokingham for securing this important debate. As so many have said, and Lord Darcy confirmed, our NHS is in crisis. Spiralling waiting lists, crumbling infrastructure and demotivated staff are symptoms of the mismanagement that was all too common under the previous government. The current state of cancer diagnosis and treatment is testament to their failure, where a lack of vision and strategic thinking has let patients and families down. Under NHS guidelines, 85% of cancer patients are expected to wait no longer than 62 days between referral, as we've heard, and the start of treatment. Last year, less than 65% did. Whilst this year it's shaping up to be even worse, with on current trends, in excess of 100,000 patients failing to begin treatment within that time frame. This is simply not good enough. The UK is a global hub for life science research, and yet we are lagging behind many countries without that expertise when it comes to applying the very research we often pioneered. Whilst cancer research is a top priority for the UK, we must aim to lead the world in outcomes too. As the Health and Social Care Select Committee made clear earlier this year, that requires a long-term strategy with innovation at its core, and a more integrated, forward-looking approach to cancer, ensuring that research, policy and delivery pull in the same and not opposite directions, in contrast to what's currently a much too fragmented system. In my own constituency in Wimbledon, there are particular concerns around breast cancer, where early diagnosis and treatment is critical. Across Merton, the London borough within which most of my constituency lies, breast cancer screening rates are significantly below both NHS targets and the national average. In 2022, less than 57% attended screening when invited, significantly lower than the 70% national standard required to make screening truly effective. Behind these statistics are lives and families, of course. When breast cancer is diagnosed and treated at stage 1, survival rates are close to 100%. But lower uptake of screening inevitably leads to later diagnosis, with a commensurate decline in survival rates. That is why my council colleagues and I have been campaigning for NHS England to provide a breast cancer screening site in Wimbledon, which currently lacks the screening infrastructure necessary to meet national screening targets. When I attended a Radiotherapy for Life session in Parliament recently, I heard similar concerns about the lack of investment across England on radiotherapy. Currently, only half those who could benefit from radiotherapy access it because, in the words of the medics I spoke to, this country lacks a cancer strategy. The entire setup is far too fragmented. To take one depressing example, even though integrated care boards are responsible for radiotherapy, some 30% did not even know this was so when subjected to an FOI inquiry. In contrast to these examples, when the cancer referral system is working well, the approach is transformational. 2 weeks ago, in the wake of an elevated PSA level, I was put on a 2-week cancer pathway. 2 days ago, I had an MRI and received a clean bill of health. It took just 10 days to give me peace of mind. Not everyone will be so fortunate, but everyone deserves that alacrity. A more integrated approach to cancer will speed up diagnosis and treatment and improve cancer outcomes. I consequently echo my colleagues' calls for this government to introduce a cancer strategy. Thank you.
Right, for the opposition, Ben Spencer.
Thank you, Mr Betts, and it's a pleasure to share under your chairmanship. And I'd like to thank the honourable member for Wokingham for calling this really important debate today. Clearly, this is a very difficult subject, given how much cancer affects people, as indeed has been referenced by several members during this debate, affects all of us, really, both those who are directly affected, and I welcome and I listened very carefully to the very powerful speeches that were made by the member for Wokingham and the member for Cheltenham in terms of direct impact that they have had. And I want to pay tribute to all the people who work in our NHS, in the charity sector, in the research sector, in all different parts of our community to support, treat, prevent, help people through the journey with cancer. In my speech, I'm going to not be able to cover obviously every cancer, but I'm going to really focus on the major cancer, so to speak, in terms of prevalence or in terms of mortality rates. That is not to diminish the importance of all the range of different cancers. I know it's something that it's critical that we don't only focus on the major cancers, particularly the rarer ones in this. So I just wanted to make that point. Just for the limited time we've got today, I'm going to focus on the major ones specifically. I thank very much the member again for working for his speech and his personal experience. He didn't mention, but I think it's worth pointing out, that he himself has raised over £800,000 for cancer charities and his work that he's done following his diagnosis. And I think it's important that we pay tribute to him and bringing this debate today. I was deeply concerned by the comments, the story from the member for Herne Bay and Sandwich regarding the impact on her constituents, specifically the cessation of treatment due to financial measures. I hope the Minister is able to meet with her or take up what's happened there, and I'd be interested to hear in terms of how that decision was taken, and I hope the family and the individual affected is doing okay with regards to his treatment. Sorry, Thornbury and Yates, I apologise. I think the member for Herne Bay and Sandwich made some very important points, and I've got my members' constituencies correct, about childhood cancer and teenage cancer, and I'll come back to that a bit later on in my response to debate. The member for Woking, I'm pleased that he raised, he's my constituency neighbour, the impact in terms of his constituents in terms of seeking direct cancer care. He will know, of course, that both our constituents are served by Ashford in terms of broader cancer support, and I'd welcome the chance to meet with him in terms of discussion how we can both help our constituents, particularly in terms of journey times regarding an access to cancer care locally. In my speech, I'm going to refer to some data because I think it's important to focus on data, and the data I've used is from NHS and Cancer Research UK, and I've got a series of questions for the Minister. I know a lot of this won't be in his portfolio, but if he can't answer the questions today, I'd be grateful if he wrote to me with responses. Fundamentally, when you look at what the state can do in terms of cancer strategies, in my view, they break down into prevention, diagnosis, care and treatment, and research. All the major cancers have modifiable risk factors. When you look at bowel cancer, which is around 44,000 cases a year, 54% are deemed to be preventable, with around 11,000 linked to obesity, 28% linked to diet in terms of fibre, 13% around processed meat, 5% around physical activity. When you look at breast cancer, which is around 56.8 thousand cases, and the most common cancer in the UK, around 8% are believed to be caused by people being linked to obesity. When you look at lung cancer, which is around 50,000 cases a year, the third most common, around 80% of lung cancer cases are preventable, 72% linked directly to smoking. Tobacco overall is the largest preventable cause of cancer, and if you look at how many cases by cancer are caused attributed to smoking, it's around 50,000 cases per year. We, in the last Parliament, brought forward the tobacco and vapes bill because we recognised the importance in terms of reducing smoking. Can the Minister tell me today when the government plans to reintroduce this bill and so we can start seeing the health benefits from that going forwards? Obesity is the UK's second biggest cause of cancer after smoking, believed to cause between around 1 in 20 cancer cases. This is around 20,000 cases of cancer per year attributable to obesity. We brought forward an obesity strategy. Will he review the obesity strategy and bring forward and obesity strategy in this Parliament. On screening and treatment, while cancer outcomes continue to improve compared to the OECD, and it's worth looking at the data in the Darcy report, I think it's actually one of the most interesting slides that shows that over the past 14 years, we have improved relative in terms of gradient, in terms of the cancer outcomes, but we started at a very low point. And I think there's lots of questions we have to ask about why we started at such a low point back in 2004. The NHS is still recovering from the disruption to cancer care caused by the COVID pandemic, but thanks to the hard work of NHS staff, waits of more than 62 days have declined between September 22 and August 24. Obviously, more work still needs to be done. Community diagnostic centres and surgical hubs made a difference, backed by £2.3 billion investment, the largest cash investment in MRI and CT scanning in the history of the NHS. These scans, tests and checks are now being delivered in 170 CDC sites. As the Independent Health Foundation recently pointed out, surgical hubs have helped build capacity and reduce waiting lists over the last few years. And despite not being mentioned in Lord Darcy's report in NHS performance, I welcome the government's intention to expand surgical hubs. Can the Minister provide more details on how many new surgical hubs will be established and what plans the government have to expand the CDC network further? Clearly, there's more work to be done to improve cancer waiting times and outcomes. The major condition strategy developed under the last government was designed to provide more impetus for improving cancer outcomes alongside other major conditions. Developing the strategy involves significant consultation and engagement with cancer charities and professional bodies. Since the election, the government has decided to scrap the strategy. Can the Minister explain why he has taken that decision? Given the time put in by cancer strategies and organisations, can the Minister explain how those contributions will be used to develop the 10-year plan for the NHS? Can the Minister explain why in the NHS consultation, which is ringing now, there are no cancer-specific questions? And given the information that we heard earlier, that 8 in 10 people want a cancer strategy, will he respond to that as part of the consultation if similar results are found coming forwards? The government has scrapped the Children's Cancer Task Force. We have yet to hear an alternative approach to improve outcomes in this area. Can the Minister provide clarity today what his plans are regarding children's cancers and the reasons around stopping the Children's Cancer Task Force? And finally, on research, which I think is more relevant to some of the rarer cancers often not talked about, we very much welcome the protection of the government investment in R&D, 20 billion allocated to 25, and core research spending being protected. This includes an uplift of 2 billion in terms to the NIHR. Something I should mention, I was funded in terms of my doctoral research fellowship by the NIHR, not in cancer research, but in mental health research. And I think it's great that we support this fantastic institution. I'm pleased that the government has kept the current rate of research and development tax relief. However, he will know that much is provided by charities, directly commissioned, much support is provided by charities. Charities provide a lot of research. They're a critical part of the cancer care and treatment infrastructure. In the budget yesterday, public services, such as my understanding is public services were protected from employers' national insurance rises. Can he help and explain what the impact of national insurance employee contributions will have on charities providing care and treatment in this area, what conversations he has had with them, and what concerns they have raised with him going forwards? And my final question is, rightly in the Darcy report and in other places, there is a focus on time for diagnosis and time for treatment following a concern around a detection of a query as to whether somebody may have cancer or part of the diagnostic pathway. When does he expect the huge 22 billion injection into the NHS will see outcomes? Or will it, like Lord Darcy has previously said in his report, does he agree with Lord Darcy's comments that the NHS doesn't necessarily need more money for outcomes? It's had quite a lot of money over the past few years from the former Conservative government. Does he think that reform is the best way to ensure improvement? Thank you.
Call the Minister, and if the Minister could finish by 16:28 to allow the mover a couple of minutes to respond, that would be helpful. Thank you.
Thank you very much, Mr. Betts, and it's a real pleasure to serve under your chairship. I'd like to start by thanking the Honourable Member for Wokingham for raising this vitally important debate about the future of cancer care and the potential merits of a cancer strategy. I'm aware of the really impressive work that he's done on access to primary care on behalf of his constituents in Wokingham. I know, and as he very movingly set out in his speech, that he's a cancer survivor. So please allow me to take this opportunity to welcome and commend his efforts in campaigning for cancer charities. And I understand that he's raised a mind-boggling £800,000 for charity. So huge tribute paid to the Honourable Member. I'd like to thank and pay tribute to every one of the members who've spoken today. People spoke with such clarity and passion, and it also became clear that many honourable members in the room, for them this is personal, many personal experiences of cancer, and I think that adds a poignancy to our discussions today. That makes it even more powerful. Access to cancer care is an important issue for many people, and it's at the heart of this government's health mission to build an NHS that's fit for the future and to reduce the number of lives lost to the biggest killers. Our work will focus on 3 shifts: from hospital to community, from analogue to digital, and from sickness to prevention. On cancer services, I want to reassure the Honourable Member who raised this debate, and others, that the government is absolutely committed to fighting cancer on all fronts, from prevention to diagnosis, treatment and research. The NHS can be world-leading on cancer care as part of a wider health system which incorporates innovation and technology. The NHS also benefits from access to world-class research and medicines. We will look to realise the potential of both. We know that nearly a third of patients are waiting more than 2 months for their referral before starting treatment. This is unacceptable, and the government has made reducing those waiting times a core part of our health mission. Thanks to the hard work of NHS staff, we are now meeting the faster diagnosis standard so that more than 75% of patients get an all-clear or cancer diagnosis in 28 days. But we know there is much more to be done. The Chancellor set out yesterday how we will invest in the NHS to deliver 40,000 additional operations, scans and appointments per week as part of our commitment to cut waiting lists, and how we will invest in new radiotherapy machines so cancer patients have access to the most effective treatment. NHS England is also working to make cancer diagnosis and treatment faster and more efficient through the use of innovative approaches such as teledermatology and FIT kits for risk stratification in bowel cancer. The NHS has made historic strides in cancer care. 10-year survival has doubled since the early 1970s. Yet this rate of improvement slowed in the 2010s, and there is still a lot of work to be done. Early diagnosis and innovative treatments are key to enhancing survival rates and quality of life for cancer patients. So we will ensure the government and the NHS works hand in hand with life sciences research institutions and industry to drive the development of new treatments and diagnostics. Members on all sides of the House have rightly raised some of the deadliest cancers, including pancreatic and bowel cancers, and cancers affecting children and teenagers. We absolutely recognise that different tumours have different diagnostic and treatment pathways, and we will consider that as part of our cancer strategy. Mr. Betts, since taking office, this government has wasted no time in taking steps to accomplish our vision. Earlier this month, we announced funding for a raft of new UK-created therapies for cancer that will be trialled in the UK. Developing early diagnosis technologies is a key aim of the National Institute for Health and Care research funding. The potential to find cancers earlier will give patients more choice of treatment and enable us to save lives in the future. We also commissioned an independent investigation of the health service in England carried out by Lord Darzi. Published in September, Lord Darzi's report set out in stark terms the profound challenges that are faced by the health service, and he was honest about the scale of the work that is going to be needed. He highlighted that people in the UK are more likely to die from cancer than in any other European and English-speaking country, and that improvements to survival rates have slowed. Lord Darzi's report also pointed to the need to improve waiting times for cancer treatment, particularly curative radiotherapy, and to expand access to the most sophisticated treatment options, such as genomic testing. Finally, not enough progress has been made on increasing the number of patients diagnosed at stage 1 and 2, the best way to improve survival. However, Lord Darzi said that there are signs of hope, thanks to the success of initiatives like the Targeted Lung Health Check programme. So we're not daunted by the scale of the challenge. It is a daunting challenge. We're not daunted by it. We know that we need to roll up our sleeves and get to work. In response to the Darzi report, and as part of our mission to build an NHS fit for the future, we've launched an extensive programme of engagement to develop a 10-year health plan. The plan will set out a bold agenda to deliver on the 3 big shifts that I outlined earlier in my remarks. Now, this is going to be a team effort. We're going to listen to and co-design the plan with the public, with the health workforce, with charities, academics and other partners. And indeed, I would encourage every parliamentarian, both in this room and right across the House, to get involved in this big national conversation. The biggest conversation we've had about our health care and care system since the NHS was founded in 1948. Please go on to change.nhs.uk and get involved. There will also be approximately 100 deliberative events around the country where you can get involved, and indeed your constituents can get involved in this big conversation that will lead to the publication of our 10-year plan strategy in the spring of next year. Organisations such as Cancer Research UK have been at the forefront of advocating for a robust cancer strategy. Their reports highlight the importance of dedicated cancer strategies in driving efforts and impact towards improving cancer research, diagnosis and care. We've launched the Change NHS online portal to facilitate that national conversation and to help develop the 10-year health plan. The journey of developing a plan is as important as the plan itself. We want the public and healthcare staff in England and all other stakeholders and those who care about the future of our health and care system to share their views, experiences and ideas. The portal opened on the 21st of October and will run for several months. Now, to build an NHS fit for the future, we first need to listen. To reduce the number of lives lost to the biggest killers like cancer, we need to learn from people with lived experience, researchers and our NHS staff. But we also recognise the need for leadership by the government, and my right honourable friend, the Secretary of State, has been clear in his view that there does need to be a national cancer plan. So we are now in discussions about what form that plan should take and what its relationship to the 10-year health plan and this government's wider health mission should be. However, we are clear that we must develop and publish the 10-year health plan in the spring of 2025 before we can publish a standalone cancer strategy, and we will provide updates on this in due course. We feel the sequencing is important. It's best to set the framework, the strategic framework, through the 10-year plan, and then we have a standalone cancer plan that is flowing from that. I can say absolutely that I've heard the message about the need for a cancer strategy loud and clear from honourable members in the debate today, and I'll be conveying that message to my ministerial colleagues and officials. So I'd like to thank the honourable member for bringing this important matter to the House, and once again thank all honourable members who've contributed on this subject today. I'd also like to thank the honourable member opposite for the constructive way in which he's engaged in this debate. He presented me with a vast range of questions, and I think it's probably better in the very short time that I have available to say that I'll write to him in order to be able to come back to him in the detail that's required, that I don't think we can have in this debate today. I'm pleased to assure honourable members that rebuilding our NHS and delivering world-class cancer services for every person remains a top priority for this government. This government has wasted no time in taking action, announcing funding which will make innovative treatments accessible to cancer patients. We've published an independent investigation of the health service in England, which has highlighted the challenges that cancer patients face and the scale of the work that is needed. With input from members of the public, researchers and NHS staff, we're now developing a plan to make the health service fit for the future and to reduce the lives lost to the biggest killers, including cancer. The foundation of the NHS is, of course, one of the proudest achievements of the Labour government of 1945. We created a service that was right for the 20th century in 1945. It now falls to this Labour administration of 2024 to shape a health and care service that is fit for the 21st century. So let's work together to get our health and care service back on its feet and ready to tackle the scourge of cancer. Thank you.
Clive Jones to wind up.
Thank you very much, Mr. Betts, and thank you to the Minister for giving me a few minutes to sum up. It's very kind of you. I'd like to thank colleagues from all political parties who have contributed to this debate. I made a note of what everybody said, but I don't think that I can go through all of them. But I have to say that I agree with the member for Strangford. We've got from the government another £22 billion for the NHS, and that really does have to be welcomed. And the member for Herne Bay and Sandwich, I'm very pleased to say that I agree with everything that you said. Children should be included in clinical trials. I totally agree with that. And I'm very pleased that he also said that there should be a national cancer strategy. And to my honourable friend for Cheltenham, I'm delighted that your wife has had successful treatment, the same that I have. Both the Minister and the Shadow Minister were kind enough to mention that I've helped raise over £800,000. But I have to say, it's not just me that has done that. Many other people have been involved in the raising of that £800,000. We did skydives, my daughters and I. They went out the plane first. It really made me decide I had to go out as well, and I didn't want to. We've had dinners, tea parties, golf days with friends. And the two very big events have been fashion shows in front of 1,000 people. And if you think that it's daunting to make your first maiden speech in Parliament, think about what it's like to walk out in front of 1,000 people dressed in a ridiculous pink three-piece suit. That wasn't the easiest thing that I've ever had to do. I was really pleased to hear the Minister say that he has heard loud and clear the request of all of us for a national cancer strategy. And I hope that in the next few weeks, few months, and certainly by the beginning of the summer, the end of the spring, that he has been able to persuade the Secretary of State that we need a national cancer strategy. It is a very popular policy. 8 out of 10 people want us to have a national cancer strategy. Many, many, many cancer charities want us to have a national cancer strategy. and it would be really good if he and the Secretary of State can help to deliver this. Thank you very much.
The question is, this House has considered the potential merits of a cancer strategy for England. As many that have been said, aye. Contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting stands adjourned.
Thank you, Chair.